Welcome back to PNB Wellness Academy. Today we're focusing on something that can make a major difference when preparing for the PMHNP boards. Not just knowing the content, but knowing how to approach the questions. When you read a board question, start with the STEM and determine exactly what it's asking you to do. Pay close attention to the words such as first, initial, priority, next, best, and most appropriate, because these words can completely change the answer. Use only the information provided in the question. One of the biggest mistakes test takers make is adding information that isn't there. Don't assume the patient has a symptom, diagnosis, history, or risk factor unless the question gives it to you. Once you understand what is being asked, begin eliminating answers that are unsafe, irrelevant, premature, non-therapeutic, outside the provider's role, or based on assumptions. If you narrow it down to two answers that both seem correct, go back to the STEM and ask yourself, which one needs to happen first? Also, be cautious with words such as always, never, only, and all. Those words do not automatically make an answer incorrect, but they should make you examine it carefully. The goal is to not choose an answer because it sounds familiar. The goal is to choose the answer that best addresses what the question is asking right now. When you see a priority question, your first thought should be patient safety. Scan the scenario for immediate threats such as suicide, homicide or violence, abuse or neglect, medication toxicity, severe withdrawal, delirium, or medical instability. A simple rule to remember is stable and unclear, assess, unstable or dangerous, act. Assessment generally comes before intervention when you do not have enough information to make a safe clinical decision. But you should never delay an emergency intervention just because you've learned that assessment comes first. For example, if a patient simply says, I want to kill myself, and the question has not established a level of risk, your priority is to assess suicidal ideation more thoroughly, including plan, intent, access to means, and relevant risk and protective factors. However, if the STEM already tells you that the patient has active intent, a specific plan, access to means, and cannot maintain safety, you already have information indicating significant danger. Now, the question may be testing what you do to protect the patient rather than whether you need another routine assessment. The same principle applies to medication emergencies. If the patient taking an antipsychotic develops severe rigidity, high fever, autonomic instability, and altered mental status, think about a medical emergency such as neuroleptic malignant syndrome and act accordingly. So when you get stuck, ask yourself, what could harm the patient right now? Address immediate danger first, gather additional information when needed, and then move into treatment. Ethical and legal questions become easier when you identify which responsibility the question is testing. With suspected child abuse or neglect, remember the sequence. Suspect, safety, report appropriately. You are not responsible for conducting your own investigation and proving that abuse occurred before making a mandated report when the applicable reporting threshold has been met. If you need clinical appropriate information from a child, use developmentally appropriate open-ended, non-leading questions. For example, if a child says, my uncle touched me somewhere bad, a response such as, tell me more about what happened is better than inserting details into the child's story or repeatedly interrogating the child. With adolescents, confidentiality is important for developing trust and obtaining accurate assessment, so private interview time may be appropriate. However, confidentiality is not absolute secrecy. Adolescents should understand that there are circumstances involving safety or legal requirements in which information may need to be disclosed. Also, remember that sexual orientation itself is not psychopathology and should not automatically trigger disclosure to a parent. Cultural considerations are another important area. A belief or experience that is unfamiliar to you is not automatically evidence of a psychiatric disorder. Explore what the experience means to the patient, whether it's culturally or spiritually accepted, or whether it causes distress or impairment. Remember, different does not equal disordered, and clarify before you classify. Finally, a psychiatric diagnosis does not automatically mean a patient lacks decision-making capacity. Think about whether the patient can understand relevant information, appreciate how it applies to their situation, reason about the options, and communicate a choice. These questions ultimately come back to balancing safety, patient rights, ethical responsibility, cultural responsiveness, and applicable law. When you're sitting for the exam and you come across a question that has you stuck between two answers, use the SAFE first method to organize your thinking. The S stands for safety. Ask whether there is an immediate threat involving suicide, homicide, violence, abuse, severe medical toxicity, withdrawal, delirium, or medical instability. The A stands for assess. If the patient is stable, ask whether you actually have enough information to make the decision. If important information is missing, assessment may need to come before treatment. The F stands for framework. Think about the bigger clinical picture, including ethics, confidentiality, culture, patient rights, capacity, mandatory reporting, scope of practice, collaboration, and the least restrictive appropriate level of care. The E stands for eliminate. Cross out answers that are unsafe, premature, judgmental, non-therapeutic, and outside the provider's role, based on the information that was never given, or simply do not answer the question being asked. Then come back to one final question. What does the patient need from me right now? You are not trying to memorize tricks. You are learning to think through the question like a PMHNP by prioritizing safety, recognizing what information you have, identifying what is missing, and choosing the safest and most clinically appropriate response. Confidence comes through preparation and practice. So keep working through questions, review why you missed the ones you missed, and don't just memorize the correct answer. Understand the clinical reason that made it correct. If this review helped you, subscribe to PNB Wellness Academy and follow along for more PMHNP board questions, psychopharmacology made simple, and high yield review. Keep studying, keep believing in yourself, and I'll see you in the next review.